Benn McBride, health and safety activist from OPSEU.
Hello, my name is Benn McBride and I'm here to discuss the issues with the COVID-19 pandemic. I'm also a retired public servant and a member of the Ontario Public Service Employees Union. We have been hearing a lot about the number of people catching the disease and the number of deaths. And we were hearing a little bit about other things that have arisen from the COVID-19, like the exhaustion of our frontline workers, our doctors, our nurses, our ENS staff. But we have not heard enough about those people who've been diagnosed with eating disorders, mental health issues, and suicide tracking. We have to think about those, and I'm going to read off some numbers now just to tell you how things are going since we started this. Right now, due to COVID pandemic, those already struggling with their rental issues, twice as many are more likely to have declined any help. 5 times the number are feeling more depressed. 3 times the number have trouble coping. 4 times more likely to have suicidal thoughts, and 4 times as likely to harm themselves, unfortunately to the point where some of these people have lost their lives. There is few accessing personal help. There are few people accessing personal help and virtual health care and online resources. We have to get people to access these facilities. We have to talk to them. We have had one young lady who had an eating disorder who has recovered to a great extent, got a good job, well-paid job, and was working permanently. Then COVID came into effect. And then cutbacks. She lost her job. She felt depressed and isolated again, and the eating disorder began to come back. We have to help these people. We have another young lady from Windsor who's had to drive all the way to Toronto to get any help with an eating disorder she's had for many years. Hopefully, we're able to expand our services so people do not have to drive that far. I have, excuse me, I have a niece, Sarah, who works at the Credit Valley Hospital in Toronto, the Adult Eating Disorder Program. They provide intensive mental health treatment, inpatient and intensive outpatient, to people over the age of 18 diagnosed with a moderate to severe eating disorder, and usually people have at least one concurrent diagnosis of anxiety, depression, OLD, PTSD, and suicidal behavior. We have to talk to these people. We have to get them to reach out to the resources that are available. I got a message video from a former Londoner, now Vancouver Islander singer named Sarah Smith, who last year at this time, just after the pandemic start, put out a song called Reach Out in conjunction with the CMHA. We have to encourage this. We have to get people to talk to people. We have to get ourselves to talk to our friends, our family, and anybody that we seem to see who is having a problem. Anybody that we know that is isolated and could have these problems, we have to get them to talk to us by phone, by getting them out for walks, walking with them, just talking to them. It's imperative that we do this. After this pandemic is over, we have to make sure that the issues that have risen are looked after. We have to expand the services we have. We can't keep them all central. We can't expect people to pay and bankrupt themselves to get the services that should be required in the municipality. My niece has said that they're looking at setting up a similar idea to what they have in Toronto here in the Windsor, Essex area. Hopefully that is achieved. And hopefully when we get through this pandemic, we're able to see the issues that have arisen even more because of it. I want to thank you for your time today, and hopefully you can get out and talk to somebody and help them.